Hello, hi everyone. Welcome. Welcome to this webinar on community-driven practices from the field. My name is Sharice Iglesias. I'm the Training and Resource Director at Community Campus Partnerships for Health. I just want to welcome you here. But first, before we get started, I want to turn it over to one of our hosts, Dr. Sharon Morrison, who will explain a little bit more about our panel. Go ahead, Sharon.
Welcome, everyone. Thank you for taking time to be here. I am, for those of you who don't know me, I'm Sharon Morrison. I am a professor in the Department of Public Health Education. I am the Community Engaged Research Scholar for the School of Health and Human Sciences at UNCG. And this is part 2 of a webinar series that highlights community engaged research. And we brought in CCPH to work with us to be able to provide some of the perspectives and training that our faculty need to continue to do good work, and also for those who are to feed the interests of those who might want to use community-based participatory research approaches in their work. I am happy to have you here. We have an exciting panel representing various aspects, and I hope that in this part 2 series, this is the community-driven practices from the field, we can have an engaging Q&A with the experts we have. So I'll turn it back over, and just happy everyone is here, and feel free again to use the chat if you have questions, or when you have questions. Sure, there will be several. Thank you all.
Thanks, Dr. M. Next slide, please. Just a reminder to everyone, it's a small group here, so please use the chat to share your questions, your comments, your reflections, your reactions throughout the session, just about the session or any particular question you have for our panelists. Next slide, please. Just a quick shout out to my organization, Community Campus Partnerships for Health. We promote health equity and social justice through partnerships between communities and academic institutions. And we're so happy and delighted to be partnering with UNC Greensboro to create this space for all of us. Next slide, please. So we have 5 panelists coming from student, community partner perspectives, as well as academic faculty perspectives. And I'd like to give them all about 5 minutes each to explain a little bit about themselves, their background, the organization, where they're coming from, a bit about their positionality, and then we can get into some questions. But of course, we want to prioritize the questions that you all have. So again, feel free to write any of your questions in the chat, and we will prioritize that before diving into the questions that we have prepared. We have Anayi Salcedo, who can represent our student perspective. We have Pat Peel and Zachary Rowe, who can represent a bit of our community perspective. And then we have Doctors Kent Key and Barbara Israel, who can represent our academic faculty perspective. So Alexis, I think we can stop sharing, and I'll pass it off to Anayi to share a bit of your perspective.
Sounds good. Thanks, Sharice. Hi, folks. My name is Anaí Salcedo. I'm going to talk a little bit about myself. So I attended the University of Utah. I was a kinesiology major, and I graduated back in 2021. So I'm going to talk a little bit about my undergraduate experience in research. That sort of started in my second year of undergrad. And I was doing lab-based research as someone who was interested in medicine and sort of in the health field. And that was sort of the main research that was pushed onto me by my advisors and my teachers. However, I did that experience for about 6 months. It was not a great fit for me. And later in my third year of undergrad, I actually joined a fellowship program run through a local nonprofit that was teaching community members and students how to do community-based research. And it was about a 6-month fellowship cycle that I participated in, and they trained us on how to do community-based research or community-engaged research. And we were focused on educational equity, working with racially marginalized communities in Utah. And through that fellowship program and the training, I actually met the co-founder of the Community Research Collaborative, which is the project I'm going to be talking about today. But her name's Ana Antunes, but also Paul Kuttner. And so I met them. They invited me to join the CRC in my 4th year of my undergrad. And they were like, hey, do you want to come do this? So it was co-creating guidelines with community members and with folks from the institution at the University of Utah to create guidelines for how to do community-based research that is collaborative with those two groups. And I was still pretty new. I had like sort of only about like six-ish months under my belt doing this kind of work. And they were really welcoming, inviting me in, and they asked me to do the literature review of reviewing other guidelines across sort of the nation and the world that were doing community-based guidelines. And so I had to review all of them and then do a presentation to the collaborative about themes, things that stood out to me, and doing that in front of the collaborative. And as an undergrad, that was sort of a lot of responsibility to do, but it was a great experience. And I felt really supported by the CRC leadership. And then additionally, in that first meeting, you know, as someone who was new, folks were really inviting and welcoming for me to share my thoughts, like how I'm feeling in the space. And really wanted to hear my ideas, someone who was new and had different perspectives on that. And it was also part of the community that we were thinking of working with. And I also just like made some really good, meaningful connections that led me to be on this panel today. And that's a little bit about the project I was involved in and how I'm here. And then I'm currently at SF State working on my credential and my master's program to teach chemistry.
Awesome, thank you. Can we pass it over to Pat Peel?
Well, I have experience on the ground in a lot of different ways. And what we've learned over the years with our partnerships with the universities as well as other community organizations is that it's very important for us to have collaboration. I have most respect for researchers and for the information that is that comes from research. I look at demographics a lot. Demographics really define who we are to others who may not know, but when they look at those numbers and the research based information, they kind of form an opinion about how we are and who we are. So our goal is to project a positive look at our area, raise our demographics, and help reflect more of who we are in our community. Researchers are very important in that effort, and we like to promote clinical trials as well as working with organizations who support women like breast cancer survivors and others who impact on our overall health outcomes. Our overall health outcomes are important. And we've learned that in working on the ground, if we can identify a goal and have some form of research or information that can help us track our progress, then there's always time for celebration along the way as we work toward improving those and changing those goals. We have done that in our work, and we started with the nonprofit organization, and we wanted to raise our overall health outcomes, and we started as number 99 out of 100 counties in the state of North Carolina. And we worked to raise that by collaborating, working together in our county, and also getting the support of universities and researchers. And we worked together, and we were able to raise those numbers from 99 to 91. And our goal was to go above the bottom 20, but then COVID hit. And then it kind of struck us at a time when we were progressing. But yes, we like the idea of research and all of those things that support us and identify us, but it's up to us to change to make it happen, to use that information to make programs, activities, whatever, that will have an impact on our identity and our demographics. So I've been working with community organizations, churches. We've even organized groups of fraternal organizations uh, who have major goals for their national organizations, and they're proud to work with us in order to help reach those goals. Also, we work with youth, our 4-H youth, and helping us with those kinds of programs and all different areas in our community to bring people together for common cause. So I've my major in college was adult education, and that was very helpful because then I learned that you have to meet people where they are, and in our role in the community, that's what we do. We take the academic information and research-based information, and we have to translate it or use it to help educate people in our community so they would be willing to change. And so I adapted the theme, educate to elevate, and thinking about moving people up, especially thinking about Maslow's theory and how people on the bottom are comfortable being there until they're educated otherwise. And so we're serious about education, and we're really happy to be able to collaborate with universities who are doing research and helping us get trained and have knowledge and information that we can pass on to those in the community to motivate them towards better behaviors.
I love that. I'm so glad you're here with us. Zachary Rowe?
Hi, all. Zachary Rowe, the Executive Director for the Friends of Parkside. And Friends of Parkside is a small community-based organization in Detroit. And I've been working in research for since 1995 as part of the founding member of the Detroit URC. So I think I'm just going to maybe say a little bit about me, a little bit about some of my experiences with doing research. It's probably important for me to set the stage by saying that initially I was a research denier. I realized that as I look back, I wasn't quite a research denier. I was really concerned with how research was done in the community. Sorry about that. Because we have to go back to the 90s when I just got involved with research and understanding how research is done in the community. A lot of it had to do with, we started to come up with names in terms of those research. We called it drive-by research, where the researchers sort of come in, get the data and leave out. Or we would call it the parachute model of research, where it seemed like the researchers there in the community 1 minute, next minute they're gone. So we don't really know what happened to them. And so then also my initial experience with research had to do with just not understanding the power of research, right? I remember one researcher coming to our community. He wanted to do a research project on teen pregnancy. And so I'm younger, right? And I was telling him that we really didn't have to do a research project on teen pregnancy, because I could tell him why kids were getting pregnant, because they were having sex. So, but what I didn't know, we did the project anyway, but what I didn't know is, what time they were having sex, and some of those other factors. And so after doing that project, we realized that, teenagers they had this sort of unsupervised time right after school and just before their parents get home, right? So me as a community organizer and as a program operator, now that tells me that we have to be really mindful and really intentional about what we do during that 3 to 5 window, right? But prior to that, though, I mean, I just really didn't understand. I really cared that much about research, right? So as I think about my journey through research, I realized that initially, at least for me and my community, really didn't want anything to do with research, right? Much less wanted a seat at the table because it wasn't our table. So why should we even be at that table? And so 30 years later, now it's important that we are at the table and involved in research projects, right? One thing I like to tell researchers is, nothing about us without us. And so I'm gonna stop there and just maybe during the course of this discussion, maybe say more about me, more about my experience. Yeah.
No, we got a reaction for that. Nothing about us without us. Thank you for bringing that to light. Okay, Dr. Kent Key, please.
Good afternoon, everyone. Dr. Kent Key. I am an associate professor here at the Michigan State University College of Human Medicine. I'm also the associate chair for Community Partner Institutional Administration in our department, which is really about taking community engaged research and the focus on the community and the researcher beyond just those two actors to really creating engagement between the community and the institution. Because we often know researchers leave, they leave and get tenure here and there. And when they leave, often the relationship between the institution and community leaves with them. So we're really exploring ways to really embed community in the decision and governance of our department so that we can really create that type of relationship between the institution and community. I'm also a Robert Woods Johnson Fellow, and for years I worked under Dr. Ehud Deloney. So I'll preface it by saying this. I never knew I was going to be in public health or in medicine or any medical school. I was an engineering student, and I was going to General Motors Institute, now known as Kettering University. And I went into the AmeriCorps program, and I got placed at a health awareness center under Dr. Ehud Deloney. And I didn't know at the time that she was such a powerful figure in community-based public health. She was part of the W.K. Kellogg Community-Based Public Health Initiative in the early 1990s, from which the Community-Based Public Health Caucus was born. She was in circles with Dr. Barbara Israel, who was on our panel, and others who really launched CBPR. And so I really learned I cut my teeth in public health as a community partner, not first as an academic. And so the lens that I bring to the world of research or to many of my colleagues is a different perspective, because I learned how to do the application and how to do the relationship building before I went and learned theories and methodologies and the science behind the work. And so I'm just excited to be able to be here in this place. I'm also one of the past chairs for the Community-Based Public Health Caucus of the American Public Health Association, and founder of the Flint Public Health Youth Academy. I'm in Flint, Michigan, where we're still dealing with the water crisis. You people just not in the news, but stuff is still happening, and the fallout from health is still manifesting, if you will. And so there's so many things that we can talk about. I am a health disparities researcher. I consider myself a community engagement methodologist because I bring the methodology of community engaged research to my work. And then I'm also the director of the Flint Public Health Youth Academy, where we are really starting to build the next generation of public health leaders here in Flint. My premise is that since Flint youth were forced to go through the worst man-made public health crisis, why not use that as a launching pad to create the next generation of public health professionals? So I'm glad to be here and looking forward to the discussion.
Awesome. We're glad you're here too. And last but not least, Dr. Barbara Israel.
Great. Thank you, Sharice. Hello, everybody. Welcome, Barbara Israel. I've decided to use, I'm at the University of Michigan School of Public Health, Health Behavior, Health Equity, been part of the Detroit Urban Research Center for the last 30 years, which is a community-based participatory research center. But I decided rather than talking more about what I have quote, accomplished, which you can find on the links that were sent out for this event, that I want to say a little bit about my background and why I do the work that I do. Some of folks may have heard this before, but I thought it was particularly germane because I grew up in Greensboro, North Carolina, where many of you all are sitting today. And both my mother and my aunt graduated from what was Women's College and now is UNC Greensboro. So I have a long history with the school. And I grew up in Greensboro during the 1950s. I am old enough to remember department stores where there were separate water fountains that were labeled for whites and, quote, colored, unquote. I also remember the Greensboro downtown movie theater had a separate entrance in the back for African Americans and persons of color. And when I was about 6 years old, an African American woman who worked with my family that I was very close to died unexpectedly, suddenly. And I distinctly remember asking my mother, you know, was our family doctor, why couldn't he save her, if you will? And her response was because she was not able to go to the hospital where he worked because it was for whites only. I didn't have language of inequity and when I was 6 years old, but I knew that that wasn't right. It had a profound influence on me, as did my parents. I grew up in a Jewish household, and the principles of social justice were very important to my family and instilled in me along the way. Um, and then from that upbringing, I had the good fortune, I went to the first 2 years of undergrad at University of Maryland and was in part of an honors program in which I had two undergraduate courses in literature, if you will, and one of them was all African American authors, and the other was all feminist authors. And I learned a lot about history and discrimination, racism, and things that I had not gotten in my public school education in Greensboro, North Carolina in the 1950s and 60s. I then transferred as a junior to UNC Chapel Hill. I was a sociology major. After I graduated, I was a community organizer for 3 years in Guilford County, which is where Greensboro is located, for folks who don't know that. And during that time, I had the good fortune to meet Guy Stewart, who at the time was the chair of the Department of Health Behavior and Health Education at the School of Public Health at UNC Chapel Hill. And he was incredibly passionate and about community-driven approaches to public health, caught my attention, and I decided if I ever went back to graduate school, he's who I wanted to work with. Had the good fortune to get both my master's and doctoral degrees under his advisement, if you will. And that sort of set my trajectory for my academic career at Michigan, where I've been had incredible opportunities at Michigan and specifically in Detroit, working with wonderful colleagues like Zachary Rowe, who've taught me a lot about community-based participatory research, the language we've come to use in the work that we do. And I look forward to sharing with you all on the panel this afternoon. So thank you.
Thank you, Dr. Israel. Okay, we'll just jump right in. Currently, there are no questions from people in the audience, but please feel free to jump in whenever. But I'm going to get started. I'm going to start with you, Dr. Key. Since you talk so much about institutional influence, institutional power, I'd love to know, and there's a question for everyone as well, but can you share some of your experiences navigating issues and meeting IRB standards versus community expectations?
Absolutely. I think that as the world of research has broadened to really begin to embrace participatory forms of research, a lot of our systems and processes internally did not evolve with that. And in that, there's an inherent tension quite often that you may face with IRB boards and even just sometime with processing payments and reimbursements back to your community partners. I always, when I talk to the young people, I say, this thing right here called your cell phone, every now and then they tell you got to get some updates, right? Everything has to be updated. And I think quite often a lot of our institutional boards, processes, and policies need to be reviewed and updated to keep up with the times. So yes, when we think about engaging with IRBs, and we have gotten to the point now to where we're even, our community partners we have community PIs now and academic PIs. We're using language, right, to demonstrate the equity we're trying to attain. But in some IRBs, they're not recognizing that. That's issues for them, right? And so I think that what we have to do is start really having the types of conversations with our IRB boards and even the national body that kind of gives guidance to IRBs about what does this look like. And it's not that much different than the struggle we're seeing in institutions related to those that do basic science research and then those that do community engaged research. It's still an inherent issue. When you look at tenure and promotion, the time that it takes to build the relationships that are necessary to do effective CBPI or community engaged research, if everyone is on the same tenure track, it is so much harder for those who are doing community engaged research, and it almost creates an incentive to not do it so that you could do and meet your milestones and your goals. And so as it relates to IRBs and institutional practices, there are a lot of conversations that are beginning to happen in some universities. I know within our department, we are having those conversations. We have been pretty blessed that our IRB kind of gets it, but they get it because of all the extra meetings that we're having with people to explain what this is and how this works. And until the universities, and I'll even go so far as to say this. I've been having this conversation on the national level with high folk at Precorian, NIH, and other places. Until funders who have the funds put pressures on the universities to update policies for community engaged work, then we really won't see the type of national impact that's equitable across all universities, because a lot of funding and a lot of funds have been gone to support research that does community engaged work. But yet a lot of our institutions have not really made the updates and have really fully embraced the nuance of what that may look like differently in their policies and procedures. So I've been saying nationally, until the funders put the pressure on the universities who are receiving these indirects to make these updates so that those that are getting the dollars for this type of research can have it and not have to go through so much tension after they get the award in the universities, then I think that it will continue to be, where some are successful here and then some are not there because we don't have a national standard. But definitely there are tensions with IRBs and other systems within our institutions around really doing community engaged work in a way, because historically institutions have not embraced this approach.
So can I jump in for a second?
Yes, please.
So thanks, Ken. I really appreciate that, that framing. And I think for me, I've been thinking about this for years. What I don't understand is when you have a research project, everybody on a research project gets paid except for the participant. And it's kind of crazy because without the participant, you don't have a research study, you don't have a research project. And so they being IRB, the researchers or whatever, they sort of say, okay, well, we only want to pay them so much money because we don't want them to do something that goes against their best interest. No, they don't want to be coercive, I guess. But it's like, that's arbitrary because $5 could do that, right? Or $100. And so, I don't know, I'm still thinking about that because it's we've seen that before, right? We saw that same trick that was played on college students, right? College athletes, how the universities can use their likeness, but they couldn't use their own likeness to get paid, right? And so now they can do that. I'm not sure we're going to see that kind of revolution or transformation in research, but at some point though, we have to start understanding that if everybody's getting paid to be a part of this research project. Why the very people that you're doing the research study on is not?
Yeah, absolutely. Pat Peel, I'd love to hear your perspective, especially on, what Zachary Rowe just brought up with the participants, or like the patients, coming as a patient advocate yourself.
We've been having major discussions simply because the work that we do and the progress that's made is dependent upon grants that come from the universities and come down to our organizations as a part of their community engagement. We do the work and we make the progress, but then we have a short period of time in which to do the work. And then we make the progress, report it back up, and then the university or whomever gets to report that in their report back up to the national, whoever the grantor is. And we've been trying to express the fact that when there is a need, and that's what we base our work on, then it should be based on the funding going to the point of need. If that is a fact, and then we can operate from that level, then we can contract up what we need in order to make these projects work and get the outcomes that we want. And I think that it's really important because we're looking to make a difference. I understand, and I heard this from someone, an important person the other day, who was at the university level, funding, offering us funding to assist them with something, and said, well, you know why there's not a lot of grants going out now? Because there's not a lot of success or evidence being shown with the funding that's going out. But the fact is, it's going out to several different levels. Well, the university gets right off the top, for administering the funding. And then it goes down to the specialists or to the researchers or whomever, and then the program coordinators and all of that and everything. By the time it gets down to the point of need, there's very little. Our organization has made tremendous impacts. And I think that's why I'm asked to come to so many different things, because we've done it with so little. You would not believe that we don't have an office, we don't have a phone, we don't have a web page, okay? So we don't have a central location where we can meet and collaborate, invite our partners and people to come in, equipment and technology and all of those things. We borrow from each other. The organization that funded the Roanoke Valley Breast Cancer Coalition, they were the hospital, the rural health group, the health department, and we all kind of had small portions of different grant funding, but we had to come together and share that grant funding and our facilities and resources in order to make the program happen. We didn't have space. We don't have those things. People don't understand the work that gets done at the community level. I mean, it's tremendous. People, their boots on the ground. And so when we make impacts and when we engage people, we have to bring in, like I said, all of the other organizations and the fraternal groups and the church groups and everybody, to try to help get the word out and to get the information, to bring people in for things like clinical trials to participate in research and whatnot. We would have to have transportation to get them to those places. We have a lack of access. We had a community forum where we brought people in from all over the community and different organizations and asked them to come up with the things that they felt that we needed in the community. And the way that they did it was breaking up into groups and discussing the issues and problems they had. Access to care was one of those things. And I've just got a text while I'm on this Zoom session. A lady asking me, where can I go and get a dentist, for my child? I mean, people, there's no place to go for information, just general on healthcare in the community. So the challenges are so great, but I don't think they are recognized enough. People that are in the area of research and what have you, they make decisions, sit there and deal with numbers, but the surveys go out and we are the ones having to distribute and collect and what have you. And just let me give you one example. And we have to hold people accountable, because in our county, our health department is, they do the county health assessment once a year, once every 2 years, I think it is. And this last one, that before this current one, the last time they did it, there were 300 people surveyed in Halifax County. 350 people, a whole county, but that was the minimum required for them to get that done. And so then we started making people aware that the results that we have from that overall health, the assessment, came from 350 people. So when they mentioned food as one of the things that they thought was, then it wasn't for the whole county, it was only for those 300. We don't know who they were. So we have to hold people accountable also that are doing the research, because otherwise it's just a simple ride and just changing and using numbers. But we have to make sure that they are concerned about people and the actual objectives. What are your objectives? And how are you going to make those available to people at the end of your program? You got 1 year to use a grant to do a project, and what kind of change can you make? What can you expect to happen in that year in reality, or is it going to be a portion of a long range goal? And how are you going to measure that and what have you? But to say the expectations are to involve 1,000 and so people and whatever, just because you had a health fair and people came by and picked up information or goodies, it doesn't mean they learned anything.
Mhm. No, absolutely. I totally agree with that. Speaking of accountability, I'd like to pass a question to Dr. Israel. If she can share types of support that are useful or currently needed from institutional players, such as research offices, peer mentors, department chairs, for faculty to conduct community engaged research. And then I would love to pass it on to Anai for the student perspective. But please, Dr. Israel.
Sure, I'll just try to quickly touch on that. I mean, there's a lot of different strategies, if you will, and things that are important. I will just pick up from my own experience in particular, and experience with my colleagues, is the importance of department chairs and deans, particularly because of the role they play ultimately in one's tenure and promotion policies. And I think it's really important for individual faculty and departments to meet with chairs, to meet with deans, and to inform them about what community-based participatory research is, to inform them of what accomplishments they've made, to inform them of the benefits, as well as the challenges that have been happening in the work that they do, so that they're aware when somebody's portfolio comes up for tenure and promotion of the impact that people have had and the value of this approach to research, where academic researchers are working in equitable partnerships with community partners. And so really doing that sort of educating, if you will, of the people in higher administrative levels. And this can go to the president as well. We've met with the president of the university here for that very purpose, talking about the work we're doing in Detroit and with our community partners. So it's not just the academic researchers meeting with these administrators, but doing it as individual, community and academic partners. And I think that that can go a long way in helping, spread the word, the value, and getting the commitment on the part of higher level administrators for the value of this approach to research. And one of the quick things I'd like to say too is that I reviewed some of the materials on the School of Health and Human Sciences promotion and tenure guidelines that were shared with us, and just really want to commend the work that you all have done at UNCG, both in terms of being a community engaged institution and designated as that, and also in terms of tenure guidelines, having the scholarship of application. I think that goes a long way. A lot of universities don't have scholarship is scholarship in the most traditional sense, if you will. And having something with a scholarship of application where, you really speak to the benefits of the work that you're doing, the application of the research findings to meeting community needs, is really in keeping with a community-based participatory research approach to research. And again, I think gives you all a lot of strength for working with junior faculty in the promotion and tenure process. So really, and I guess one other point with that is just how important it is for faculty to come together who are shared similar interests, kindred spirits, if you will, of this approach to research, and collectively, deciding who should we meet with on campus, who do we need to educate, if you will, about this approach to work. So it's not just individual faculty members trying to do this on their own. So those are just a few thoughts.
Yeah, I love that. Thank you. Anai, do you have any thoughts on that?
For this question, right? Yeah. Well, I was thinking as Barbara was sharing, I do think that I was looking at UNCG and y'all like fund undergrads to do this kind of stuff. That was not my case when I did it. Like in undergrad, I like had to work through my undergrad. It was just like a reality of my situation, and trying to get involved in this kind of research, that's really important for undergrads to be able to, access funding, to be able to participate in something additional. I was lucky enough that the work that I did, the community partner was actually able to offer that funding for me as a student. But additionally, I think, I didn't hear about community-based research or community engaged research or CBP or any of all that stuff until my third year of undergrad. And I had like never heard of it. We sort of never talked about. I do think that's like a huge thing. It just like never really comes up. And I do think I wish I would have learned about it sooner, just like as like a breath of like a whole new world of like what I could do for a job, for a career, for, it's just like, it's huge. It's just like missing piece for me that it really did impact like where I went. I did community engaged, community organizing work for 3 years after my undergrad because of this work. And so, and it's like super impactful, led me to like where I am today. And so I do think awareness and access and like people to talk to, like, who's done this? Where are you at? What are you doing? Things like that is so important, especially when you're just trying to figure out what is my future and what am I going to be doing? And even if you already have an idea, to be able to evolve and change that perspective is important. And yeah, and think also like, how can you access a training? Like, can I like just pop in somewhere and learn about what it is and then engage it and find opportunities to engage in it a little bit, but also be in a project and engage with like professors and other folks to like be a part of that kind of research is super important.
Yeah, absolutely. And we do have about 10 minutes left. So I want to pass it on to Dr. Kent Key again to talk a little bit. I was really inspired when you talked in a previous conversation about the committee that you helped form yeah, please.
Which one?
It was the 3 C's. Was it that one? The committee.
Yes. So part of my work in this role, in my co-chairship of our department, is we are creating a community co-governance council. And this council is made up of community members who will be paid for their time, but who will also be representatives at various decision-making tables in our department. Part of this is, one, we need to show that our relationships with community are not grant-based and they don't sunset when the grant is over. Secondly, we wanted to ensure that if we're going to say that we are a community engaged department or a school that highlights and has the emphasis on community engagement, the proof has to be in the pudding. And a lot of our community partners here in Flint who have been a part of community-based public health and CBPR for decades, you know, a lot of our local community partners and leaders don't want to be on advisory boards because they realize there's no decision-making power at those levels, right? Researchers can still do what they want to do and just check the box and say, yep, I ran this by community and we had the discussion. Well, community wants to sit at governance tables and at places where decisions are being made. And so we're offering that opportunity through our 3 Cs, and we're actually institutionalizing it because it's being written into the bylaws of our department. And so this is something that's important for us because, one, it is another step towards building that relationship between the community and institution that's not researcher dependent. And it also provides an opportunity for community to not just have a representative on a strategic planning session for the department or the school, but to actually give voice throughout the year on decisions from faculty searches to scholarships to finance to, curriculum development, sitting on our accreditation committees and all of those things. And so it really allows them to have a institutionalized space within the institution so that community voice is embedded within and not extracted from without.
Yeah, one of the really insightful things you said in that conversation is that we focus too much on community and researcher readiness, right? And not so much on
Yeah, one of the articles that I'm working on writing up is because for so long we talked about community readiness for partnering in research and we talk about researcher readiness, but what about institutional readiness, right? What's the metric? What's the discussion around creating capacity for institutions to embrace community engaged research? And that's the inward work, right? That, like Dr. Israel was talking about, going to your dean, having these conversations, but then they have to go beyond the conversations to where they're actually put into practices and policies that uphold and strengthen this type of approach to research, right? And so I think that's the work, that's where we are, and that's the work of it. And I think I said before, it was kind of like, it reminds me of I call it the war or the battle between what qualitative research is and really research, only quantitative is. And, you know, you had the qual folk versus the quant folk. And this is really similar where you have the basic research folk versus those that do community research. I don't mean versus in an adversary, but I mean in a comparison type of way. And I think that we really have to work towards that. And so creating this co-chairship for me, looking at community partner administration, and then also creating and embedding a community co-governance council within our department is one way to start that for us here at MSU.
I love it. I want to go to MSU now. But I want to pass it over to Zachary Rowe. And then this is a question maybe for our community partners, and I'll pass it to NIE. And then we'll close for the day. So for Zach, UNCG, as we all know, is a minority serving institution. So what advice or suggestions do you have regarding community-centered practices or processes for approaching and seeking out academic partnerships?
Wow, that's a big one. And I think for me, just sort of think about my experience. And I think one of the things that we don't do enough of is sort of asking for help, asking for mentors. And I think we just have to feel comfortable enough to be able to sort of do that. And when I think about our work in when I think about our work in CBPR 30 years ago, there was really no one that we could sort of ask for advice or mentorship because we were, we were sort of, blazing the trail, I guess, in that instance. But now there are so many folks that's around, that's in the institution and outside of the institution that people can sort of talk to. Ken Keys, he's an expert. I mean, I would definitely encourage everybody to hit up Dr. Key for advice. But I think if I were to give any advice to anybody, it would be to realize that there's nothing new under the sun, and then what they're proposing to do, someone's already working on it, and just reach out for help, ask questions, keep asking questions until you find someone that's going to give you the answer.
Yeah, we have a question for
Grace,
you.
can
Oh,
can
go
I
ahead.
jump in really quickly?
Yeah.
Sorry on that.
Yeah.
Just sorry to pick up on stuff that we're doing in Detroit, but I think it was really important because when we got started, we really didn't know the community-based organizations. I was an outsider. I moved from North Carolina to Michigan. And so I think it really is so important for academic researchers, I'll speak from that perspective, to try to talk to a lot of people and listen. Folks like Zachary Rowe, about what does your organization do? What are you interested in? How might we, work together? Who else, what are other organizations in the city that are doing similar kind of work? And really focusing on what I learned actually from a Flint colleague decades ago to call community-based organizations rather than agencies, which are organizations that are embedded in the community, highly regarded by the community, staffed by community members. So they're not, quote, just service delivery agencies, if you will, but really are committed to community capacity building and community change, as well as the services that they provide, and then starting to develop relationships with those groups. And then, over time, seeing, do we have something in common to work on together in a CBPR approach to research? But it's really developing those relationships and listening and asking questions of community groups, and doing sort of a social network, if you will, who talks to whom and who knows whom, and how do we engage with different groups. That's because as academic researchers, most of us are usually not from the communities we work in. And I just think that's a critical piece for, as a minority serving institution, the UNCG is a way to approach other groups within the city of Greensboro and beyond.
Yeah,
So
absolutely.
sorry for interrupting there.
No, we want to hear your thoughts. So we actually have a follow-up. What are your success strategies for mentoring junior faculty? I know you mentioned it a little bit already, but if you have any other tips.
Do you want, well, I'll start and then Kent, turn it over to you. Similarly, it's spending a lot of time, it's listening, and my experience has been providing junior faculty an opportunity to join partnerships and projects that we have going, or others with more experience, if you will. So it's not sort of, here's a checklist of what you need to do, but rather come join me and let's work together over the next year on this partnership, and the sort of learn by doing, and then providing feedback along the way. Detroit's an hour away from Ann Arbor. We use that time in the car to talk about, how did the meeting go? What could we have done differently? And it's a great opportunity, if you're working with junior faculty, to provide that kind of feedback. It's informal, in a car, it's not threatening. Still pay attention to driving, of course. So I think those things are really, and just being open to their questions, and being responsive, and constructive criticism, but not, being negative, if you will. So those are some of the things that I've tried to do. And one really important thing with publications, because CBPR takes a long time with developing relationships, is just letting junior faculty realize that there's, one, multiple outlets to publish, but two, that you can publish process papers. You don't have to wait till you have the results of a study, because that could be 3 or 4 years, and you don't have 3 or 4 years, that kind of thing. And so that meant the message that I hear all the time from junior faculty is they were told by other senior faculty, don't do CBPR till you get tenure. if you wait till you get tenure, you're never going to do CVPR, you know? So I really try to encourage there are ways you can survive and thrive as a junior faculty and get tenure. And fortunately, we have a lot of good examples of that having happened.
Okay. Dr. Key, did you have anything to add about coaching junior faculty?
I not really ditto to what Dr. Barbara Israel said, especially the process piece and publishing on process. For me, it was also about I'm a conceptual model person, so I was able to create a lot of conceptual models around different types of engagement and publish along the way. But I think another thing is really one of the most valuable things that I do as I mentor junior faculty, but that I also received on the junior faculty end was research, my senior researchers opening up their networks to me. That is so valuable. You know, Zachary Rowe just said on this platform, if you need an expert, Dr. Key is one. Simple things like that, like literally opening up your network can be invaluable. And I have gotten so many things from fellowships to grant opportunities just because someone that was mentoring me opened up their network, and it's an invaluable process.
Awesome, thank you. So I want to pose a question to Anai, and then I will let y'all think of the answer to this last question in the last 2 minutes. The question for everyone besides Anai is, why is community engaged research worth it for you? But for Anai, I really like to know how or in what ways did your involvement training in community engaged research enhance your classroom learning or your technical skills or your cultural competency or prepare you for the workforce? Any of the above.
Yeah, I'll try to keep it quick. I think for me, I mean, I think learning community-based research for me has a lot of like practical applications, like building relationships, understanding those things take time, and like what does it mean to like really like commit to like building relationships with communities. Like as a future educator, like how do I get engaged in the community around my school? How do I like get to know my students, get to know, and also like with cultural competency, like a lot of folks from different backgrounds, different experiences. How can I really just be aware to that and like be willing to learn, really being willing to listen? But I also like I got to train about like under other undergrads CBR in my like future work. And it's just like once you do like this kind of community work, I feel like you stay in the community. Like folks know you stay connected. And I think that's something that I'm always going to keep with me is like the relationship building component and like talking with people and getting to know other people. And it's just, yeah, it's been awesome. So thank you.
Awesome. Okay, Pat, why is community engaged research worth it for you?
Why is it what?
Why is community engaged research worth it for you?
Oh, I learned a lot about the university level and the research process, things that happen, and that create the questions that need to be answered in terms of working on the ground. But I would like to recommend that any student looking to do uh, engagement outside of the campus or in any area, spend time in that area. I don't think anything that we can learn in the classroom or, what have you, is going to prepare us for what it is. When we're in the classroom and we're instructing or facilitating, we are the knowledgeables and they listen to us and do what we say. In the community, that doesn't necessarily happen. There are challenges even within the group that you're working with. People have different lived experiences and different ideas. They challenge you on every hand, but getting people to understand, how to work together and the value that is in it for their community. A shared living experience is very important. They have to kind of agree to that. So I think it's different. I learned more on the job in the community than I did in either university. I went to Bennett College. I went to East Carolina University. I went to NC State University, all of those places, but still learn more from my experiences in the community. So it's a different thing. You gotta just be there to know what it's like. But it's wonderful. I enjoy it so much. Yeah.
Yeah, no, it's great. And we are over time, so maybe just one more. Zachary Rowe, why is community engaged research worth it for you?
And I think just piggybacking off of what Pat said, for me, it's not just worth it; it's essential. And I wish there were some other words added to community engage, because I think sometimes when people think when they're doing surveys in the community, that's community engage, right? And I really want them to really be more present in the community by partnering with the community. So I know that there's this continuum of research, but we need to keep pushing that community engaged so we get to community-based participatory research or community. We need to keep pushing that needle, because if you're doing research about the community, you need to be in the community doing that project.
I love it. Well, thank you all for staying 3 minutes over time. I want to thank our panelists for being here, for teaching us, for sharing their insights and their lived experiences. And I hope everyone has a lovely day. Thank you all for being here again. Bye-bye.
Bye. Thanks, everybody. Appreciate your
Thank
interest.
you. Thank you so much.
Glad I could make it.
Yeah, I'm glad you were here, Pat.
Thank you, everybody. I'm pleased, and I've learned a lot just listening, and I know there's more to be done. So, and I commend you all and thank you for your time today.
Thank you, Sharon, for organizing us, and Sharice and the CCPH folks. Really appreciate it. And it was, I commend you all. You had 25 folks and nobody cut off until after we officially closed it. That's unheard of.
Very cool. Okay,
So,
thank you.
all
Thank
right.
you so
Take
much.
care, everybody.
Bye.
Be
You
Bye,
have a
well.
Barbara.
blessed rest of the
Bye,
day.
Dr.
Thank
T.
you.
Yeah, great to see you.